So a little bit of switching pace, especially for something serious like mental health. This is something not quite as serious, but I still think it's something that's overlooked, and it's pretty interesting to me. So the cutting edge of plastic surgery and aesthetics, okay? All right, so traditionally in plastic surgery and in a lot of plastic, there's a lot of invasive cutting. So this is like the diagram for like how they would cut for a facelift, like where they would cut it. And as you can see, there's a pretty big incision, and sometimes it'll even go to the back of the head, and sometimes it'll even go up into the forehead too, which can be pretty intensive when especially when you're trying to heal. And even during like a nose job, the nose is cut at the base, and they kind of peel it back like a grape. Which sounds really gross, because it is gross. And they also remove the bone too. They'll cut the bone and then they'll remove it. It's kind of like a controlled break or a controlled fracture. So it's not really the most, it seems kind of barbaric in a way to do this just to look a little bit better, maybe have a little bit of tweak here and there. And especially, all this cutting really results in, like I was mentioning, long recovery time, because you are healing from a wound. You can miss work, which is where the real cost of it comes in. There'll be a scar. You have to take care of the wound. And of course, there can always be complications, especially when you're going through a serious surgery. And of course, when they're cutting, 9 times out of 10 you have to go under anesthetic, which is a big risk in itself. The other problem with it traditionally is that things are very permanent right now. So the plastics are, a lot of it revolves around implants. So this is just like an example of like chin and jaw implants from Implant Tech. Like breasts, chins, jaws, cheeks, it's all like an implant that they actually put inside of you, which can cause problems within itself. But don't get me wrong, this still gives good results. Like I'm sure she's very happy. Likewise with this guy, I'm sure he's also very happy. But they can be rejected by the body. And I'm sure this is something you guys have heard about too, especially when we've been talking about organ transplantation. These can also be rejected by the body. And even if you take them out after that, there's still scar tissue that remains, and that scar tissue surrounds the pocket that the implant was previously placed in. So you take it out, you still have all this scar tissue, and you still have this pocket in the area where they put it in. And also, aging of the implant is something people don't really think about. You know, it looks great now, but when you're 80 or 90, is it gonna look the same? Probably not. Also with chin implants and other implants, they screw them to the bone, so that can create the risk of like osteoporosis. If they're actually drilling and making holes inside your skull, how is that gonna age? Probably not the best. But again, we don't really know because they haven't been around for that long. Another thing with traditional plastic surgery that's kind of a problem is that we create the appearance of youth rather than actual youth. So like in a facelift, they'll cut right there on the temples and then they'll pull it back, which isn't actually making you younger or making your skin healthier like a younger person's would be. It just makes it look younger, which is kind of a problem because it's just like a simulation basically. And again, this is an example of that. It can still look good, and it still gives the illusion of youth. You know, she obviously looks much younger in the afterwards, but is her skin actually, if you were to look at it under a microscope, would it actually be healthier, and would it actually look like that of a younger person's skin? It wouldn't. It would just be stretched out old person's skin. So the problem with this is that it can look really unnatural, as you see there. It can make you look tighter and not younger, or just different instead of looking better. So sure, you're smoother, and but that's all you are. You're smoother. You're not younger. You're just smoother. You're just a smooth old person, and it's not really the goal. So we've got all these problems with plastic surgery. There's a lot of cutting, it's risky, we don't know how it's going to age, especially if it's like an implant. It's pretty expensive, especially when you cover anesthesia costs and hospital costs, and it just mimics youth. So a lot of the new innovations in plastics kind of aim to remove all of these problems and kind of try to find a solution for them. So today's demand, there's something that things that are reversible, temporary, minimally invasive, you just go in and have it done and you're back to work the next day. People can't really afford to miss work anymore. It's not something, you know, the cost of plastic surgery is a lot, but the big thing for people why they can't afford it is because they can't afford to miss the work afterwards. And it's relatively risk-free, because people are very scared of the risk, because when you think about it, it's not like it's heart surgery, you're just doing it because you want to. So one of the innovations is the 15-minute nose job, and what they do is they use a hyaluronic acid filler, and hyaluronic acid is a material that's present in your own bodies. It's based on sugar, and it's a molecule that it holds water. So it attracts 1,000 times its weight in water, and what they can do is they can synthesize this in a lab, and they can kind of inject it in the areas they want to perfect. So here, even though it looks like they removed the bump, they actually just injected right there, and then right there. So the bump is still there, they fill around it, basically. And they did to his chin, too. So like I said, they just fill in the areas around the bump, which can give you a better aesthetically pleasing nose. If your nose you feel like is too flat, they can increase the projection of it as well that way. And they do it while you're awake. It's completely painless, 15 to 20 minutes, even 10 minutes. And a traditional nose job starts at $6,000, at least for this area. But this is only about $1,000. You might be swollen for a little bit for the next day, but you can definitely go back to work and no one will, notice a thing, except, oh, you look different a little bit. It lasts a year, so that can either be a good or a bad thing depending on what you want. Yeah, you have to go in every year to get it done, but at the same time, if you don't like it, then who cares? It just goes away. Or they can inject it with something else that just makes it dissolve completely. So, pretty cool. They have some that last 2 years, some that last 5 years, but traditionally people use the one that lasts a year. So these hyaluronic acids have different thicknesses, and they can inject these either deeper or they can inject them more superficially in the skin. They can inject them close to the bone, they can inject them on the surface to smooth things out, and they can use them for anything. So here, it's a new jaw, as an example. So they just kind of filled in along the edge there, and that would probably, the ones they usually use in the jaw are close to the bone, last about 2 years. So that will last them a good 2 years, I would say. And then in the cheeks too, so I think. Yeah, for her too. As you can see, her lower mouth area is a little bit compressed, so they just tried to open it up a little bit, so they added to her upper lip, to the nasolabials, and they did her nose actually, and her chin, instead of being squared off, is now pointier a little bit. So it can be really used to sculpt the whole face, to do whatever you kind of want to look like. And as you can see, she's wearing the same shirt, like it's literally 15 minutes afterwards. And then there's an example of lips too, which is, I think a lot of people think that the Kylie Jenner lips is what it looks like, but usually they're trying to create something a little bit more natural and a little bit more aesthetically pleasing. So, that's really good, but you still have to think of the issue of that's changing the way you look. To make someone younger, you need to tighten their skin. And yes, you can cut and peel it back, kind of like a grape, but again, that's only creating a simulation. So this is a device called the EndyMed, and they've got a few of them, like the Infinity I know, and they use radio frequency. So on this tip here, it has electrodes, and there's a computer. I think the next one, no, I'll show you guys in a sec. So you see these little needles here? There's a computer that manipulates the flow of current between the two of them. These electrical currents repel each other, and that's what creates the radio frequency. So this kind of shows it. So there's a positive, the negative, and they create the radio frequency. And the needles that are on the tip there, right there, they shoot that energy into the dermis. And that energy kind of makes your skin constrict like shrink wrap. And usually they do it over the course of 6 treatments, but it causes heat inside the skin without giving you a burn. And that also stimulates the collagen and elastic fibers to create skin that would actually be younger under a microscope rather than just looking at younger. So here's a younger person's skin that's like all of us, dermis, epidermis, but as you start to lose these fibers that support the skin structure, and as you start to lose fat in the face, that's when you get variations, which it would be like a wrinkle, you know. But if they can stimulate these to create like a better framework, it puffs this back up. And usually they do that in like a series of 6 or a series of 12. So here's an example of someone who actually had that done. Her skin is actually younger. It's not just, you know, they didn't just cut it and pull it back. She had 1 week of minor peeling, redness, costs about $8,000, but when you think about it, a facelift is usually starts at $15,000 and goes upward towards $60,000, which is a lot of money when you're thinking about it. She didn't have to miss any work. That's another issue. If you had a regular facelift, it would be like 3 months of like lying in a bed. which is not fun, with drainage tubes too. So another way they can stimulate youth too is through plasma injections. So what they'll do is they'll take a patient's blood and through an IV, they'll put it in a centrifuge, and you guys have probably seen this before too, especially if you had your blood drawn. In between the plasma layer and the red blood cell layer, there's a platelet layer, and that's also known as like the Buffy coat. There's stem cells in there. So what they could do is they could take those stem cells to regenerate areas of the skin, either by re-injecting them or putting a bunch of holes over your face and then kind of rubbing it on your face. So there's an example. So in this case, they would use a device like this or this. This is called a dermapen, and this is called a microneedler. This one's kind of an older technology. This is more of the up and coming. And they just roll it across your skin or press it on your skin. It makes little holes in your skin. And then they would rub the stem cells on top of it, and they would travel down into the dermis, which is pretty interesting when you think about it too, because this doesn't just have applications in aesthetics. They also can inject it into people who have bad knees or bad elbows or joints, or it's reparative. Yeah, what's up?
Why is there blood? Is that just from
Well, it would be from both. It would be from the holes, and then it would be from them rubbing it on there too, yeah. But as you can see in the before and after, she's got like some marks there from this damage from the sun or tanning, and then afterward they're gone. So it's tricking the body to repair itself. Something really interesting that I didn't even know existed is this new cream called XAF5. It's a topical chemical, and it treats, I'm not going to begin to pronounce that, but that's a fancy word for under eye bags, which is actually a medical condition. So you apply it like a cream, or your dermatologist would apply it like a cream, and what it does is it destroys fat cells. So it binds to the fat cell receptors on the surface of the fat cell, and it forces them to explode, and they expel their oil contents out, which you just, it leaves through your waste. And then it kind of reduces the puffiness, because that's all this is an excess of fat cells underneath there. What's really interesting is that this was first discovered when patients who had glaucoma, they gave them the eye drops, and they noticed their eyelashes would grow really, really long. So then they made a product based on that glaucoma prescription. They made a prescription for inadequate eyelashes. People who used that started noticing that they didn't have as many eye bags. So then they're converting it into a cream. So it all works in the same process, but it was discovered through glaucoma. And this is going to be available in 2019, this product. And they're looking at applications for other places, like could you apply it to your stomach, or could you apply it to your arms, and it'll actually remove the fat. This brings me to non-surgical lipo, which is what they're doing right now a lot. So they observed that children who suck on popsicles a lot create dimples. And what a dimple is just like a recession where there's no fat in the face. So it's called cryolipolysis, and that is basically a fancy word for destroying fat cells through freezing temperatures. So the cold kills the fat cells, but it's warm enough not to damage the skin. Like you're not going to get a frostbite on your face. So one of the machines they use, it's like this big, it's like a big white box, and they basically put your stomach into it, and it like freezes it, and you kind of sit there for an hour. And then over the next 4 to 6 months, it just kind of goes away. And you actually, I know people who have had this, it expels through your urine, and you can see it in your pee, like the fat cells coming out in your pee, like chunks. So yeah, but when you consider the alternative, which is actually getting it sucked out by like a vacuum, it almost seems better. And this is permanent. You'll never gain the weight in that spot again. Because when you think about traditional gaining and losing weight, it's the fat cells that expand and shrink, expand and shrink. There is no fat cell to even expand. So it would just, you could gain weight in that area and be flat. Yeah, what's that?
Would this also cause like the skin to shrink too? Like larger people when they lose a lot of weight, they have like skin.
So it wouldn't cause the skin to shrink, but if they did it on like a very large person where there would be extra skin, the extra skin would still be there, which in that case you'd probably have to cut it because there'd be so much. But I guess the benefit of it is that there's no risk of anesthetic, so if someone is heavier and they can't really go under the risk of surgery, like their heart couldn't take it, then this would be like an option. Primarily they're using this for more cosmetic reasons, where it's like, if you pinch an inch, it's not really like at the point where it's like, oh, someone's morbidly obese, let's freeze them. You know what I mean? So, good question. And there's an example of that too. So, as you can see, she's not like obese or anything, it's just like a normal stomach that she wanted to tighten up. But it looks pretty good, especially 4 to 6 months afterwards, you know. Do it in the wintertime, ready for summer. This is another thing they use called liposonics, and this is the opposite of that. So it heats the fat cells to melt them. So when you think about it, there's 2 ways to kill fat cells. Freeze them, heat them, like cook them basically. Now a lot of people would be like, well normally wouldn't that make your skin burn? Or, well this uses ultrasound, and the ultrasound is very dense. So it can shoot the heat past the skin into the fat, and that can actually dissolve it. So I have a little video on it, which is kind of interesting.
In the next room, Dr. Day treats Ellen Tribby
I'm just marking out the parameters.
using a brand new and more powerful ultrasound tool to melt fat without surgery.
Liposonics is the newest kid on the block for helping to resculpt and melt fat.
Like liposuction, you mean?
It's like liposuction, but it's a non-surgical approach. So what it does is it uses that high-density focused ultrasound to actually heat up and melt fat.
And that's new.
And that's new. If you can pinch an inch, then liposonics will work for you. Hi, Ellen.
Hi, Dr. Day.
In the weeks after her treatment, Ellen will lose an entire dress size.
The idea that that's reacting so well means you're really going to have a great response. And you'll notice over the next few months, your stomach will get flatter and smoother, and you'll have just more contouring.
Perfect.
Good.
And her cousin, Lauren and Sully, who had the same treatment a month ago, is seeing dramatic results.
I was a 6 before I had my liposonics, and this is a 2.
That's amazing. Is the bruising all done?
The bruising is completely gone.
And this continues at someone else who had it done, but you can kind of see. Pretty interesting. So the takeaways from this is that people are really going towards less invasive procedures with less cutting, less risk, quicker healing. They don't want things that just mimic youth anymore. They actually want to be younger, almost like regenerative medicine. People are scared of things that are permanent. They want things that are semi-permanent, temporary, things that will fade with time. That way they can kind of test the waters. And it tries to be more affordable. Some things are still, in their infancy, so they're going to be very expensive. But it tries to be more affordable option for, real people who want to look a little bit better, but they necessarily don't have the funds to go under anesthetic, or they don't have the funds to even do it in the first place. And there are my sources.